Hello everybody, I'm David Byrne and I'm the presenter for this session. For those of you who haven't joined us before, CECAN stands for Centre for the Evaluation of Complexity Across the Nexus and has been transforming the practice of policy evaluation across the food, water, energy and environmental domains, essentially trying to make it fit for a complex world. This has been achieved through pioneering the testing and promoting of innovative policy evaluation approaches with UK government departments. You can find out more by visiting the CECAN website, which you'll all be familiar with because that's what you use to get into the webinar. Today's webinar is about the difference between adrenaline and core strength and has the subtitle, Investing in Resilience as an Organisational Capability. We're delighted to have John Ainger and Henrietta Curzon, who are presenting the webinar. John's a director and Henrietta is the innovation lead at IMPOWER, which is the country's largest independent consultancy focused exclusively on the delivering of better public services. Their book, The EDGEWORK Manifesto, which I've read with great interest and enjoyment, describes how to deliver change and impact in complex systems. COVID, I think, demonstrates exactly how we need to build resilience into these systems. So John and Henrietta are going to speak for around 45 minutes, and then we'll have some time for Q&A. You can see the Q&A box at the bottom. They're going to pause at least once to raise points for clarification, but please put this in the Q&A where they can see them. You can submit questions for the end discussion at any point via the Q&A box, which you should be able to see on the Zoom webinar control panel. The session will be recorded and will be later made available on the CECAN website along with the slides. So I'm going to hand over to John to begin the presentation. Cheers.
Thank you, Dave. Lovely to be here and delighted to be able to interact with all of you. Just to sort of very briefly kick off with an introduction, our work is with local government and health in public services in the UK. And our interest in coming here today is very much because when we took on the task of publishing a book, it was launched a year last October, our origination for that was very much kind of talking to some of the key people in CECAN network who helped us to navigate and understand what complexity was in the latest academic thinking and the latest practical thinking in that space. So that's the link for us. It's really really helpful. But of course, within 4 months of us publishing the book about complexity in public services and disruption generally, we all faced one of the largest events I think any of us can really remember in terms of disruption in the global pandemic. And of course, that's hit public services incredibly hard, and it brings home really one of the core thinking. The core tenets, if you like, of complexity, which is that, can you move on, Henry, that disruption is really the core business of public services, and in particular councils who we do a lot of our work with. And that if we are to deal with that properly, we have to accept that disruption is an ongoing challenge, whether it's a pandemic or it's a small event, but that it is the norm. And given that that's true, it felt to us that COVID provided a unique opportunity to study the effects of disruption on local government in particular. And so we partnered with the County Councils Network to get some volunteer councils to help us build, refine, and then help to share a framework which looked at organisational resilience given complexity and looking at what good looked like if we could do that. And so Henry has been leading the work on this, and we'll take you through the thinking and some of the findings, and then want to interact with this group very much to kind of learn from what your experiences are and get your takes on it. And as Dave said, we will pause to get some discussion going as we go through this. Moving on, given that disruption is a sort of a normal state of being within complex systems in public services, we felt it important to take a look at what does organisational resilience actually mean. And so we have attempted to take a definition, and this is it. to start with. So organizational resilience is the ability to anticipate, adapt to, and bounce forward from disruption. So for us, really important to distinguish organizational resilience from what it's sometimes, I think, mistaken as, which is just a scaled up version of our individual resilience, which has become quite a kind of a trendy thing to look at in terms of mental health and sustainability and all the rest of it from an individual's point of view. But this is obviously more than that. But also, I think, to distinguish it very clearly from what is also often understood to be in resilience, and particularly in local government, I think this is an understanding, which is the ability to keep going, to persist. And I think we want to also say it's yes, and it's more than that. And if it is a capability, can we actually define it? And then can we create the conditions for investing in it continuously? So one way to characterize that difference is that, and this is one that we've sort of started to use, is that the way to describe that is that it's the difference between adrenaline, which is a response to an event where we get through it through a change in the way we our hormones and the way our chemical response in our body changes our physicality and our mentality as well, and core strength, which is something that you build up over time and allows you to focus on recovery as opposed to response. And that's part of what we're trying to do here, is the difference between adrenaline and core strength as a capability that you can build. One of the things that we have done is talk to chief execs and leaders of local government as part of the presentational aspects of our research. And one of the chief execs said that they'd been using the phrase, the difference between a sprint and a marathon, to characterize how they were dealing with COVID. And I think that's an interesting, but actually fundamentally different description than adrenaline and core strength, because the sprint and marathon just describes how long the event is, whereas adrenaline and core strength, we're trying to talk about a capability that gets built. So at that point, I'd like to hand over to Henry, who's going to talk through some of the details of the model, how we've built it up, and some of the findings, and then she'll hand back to me to conclude the presentation. Henry, over to you.
Thanks, John. So yeah, I'm going to touch on the actual framework itself. And the first thing to mention is that we've taken a real iterative approach to the framework. So we've revised it with kind of each step of our research and our learning. And there's just kind of an example of that here. But based on our desktop research, we started a framework and a structure around the different types of risks, known risks and unknown risks, and the different types, forms of resilience, whether people have the technical infrastructure in place and the soft infrastructure in place. And we started to, when we started to use that with our first council, we realised it wasn't quite landing well. It didn't really relate to how they saw their organisation. So what we started to do then is actually talk about themes and understand where is it within an organisation that you really need that strong resilience and that strength of resilience. And then we've tested that now across 9 councils with 40 interviews with senior leaderships across these councils. And we've really now kind of built on those characteristics and ascertained from those characteristics an understanding of where key resilience capabilities should be applied. So rather than just talking about staff, key is actually staff engagement, empowerment and well-being. Rather than just talking about performance, actually it's leveraging finance and performance intelligence that is key to enable an organisation to be resilient. So as a result of our kind of research and the interviews and that iterative approach, we now have a framework for assessing an organisation's resilience. And that has 3 capabilities as well as the 6 characteristics that I've just highlighted. So in terms of those 3 capabilities, the first one is an absorbative capability. And that's the ability to undertake rapid change, to be able to persist, to be able to keep on going during a disruption. Then we also have the adaptive capabilities, and they're the abilities to make incremental changes, to be able to move forward. And lastly, we've got the strategic capabilities, And that's the ability to ensure positive change is sustained and optimized, and also to be able to prepare for future disruptions. And by building those 3 capabilities for each of those 6 characteristics, an organisation will be able to be resilient. And it's not just a pretty diagram. So behind each of those capabilities, against each of the characteristics, we have a number of indicators. So there are actually 62 indicators altogether. And it's those indicators that we're looking for in terms of the evidence that an organisation has resilience. And that's what we're assessing against when we're using this framework. In terms of the indicators, there are more in the strategic capabilities than in the adaptive and the absorptive. And what we found actually while we've been doing this work is the strategic capabilities a lot of the time are giving the framework for the other capabilities to be able to exist and enhance and to work well. So an example of that would be that in the strategic leadership and decision-making characteristic, we have a capability around trust, a strategic capability around trust and respect being built between leaders and officers. And actually what we found is that has been really key for the absorptive capability of being able to flex governance arrangements really quickly during a disruption. So when we've done the assessment of an individual council, the framework then allows us to analyse that information in a number of different ways. And I've got a couple of examples here. So on the left-hand side, we've got an example there from one council showing the absorptive, adaptive, strategic capabilities against the 6 characteristics. So we can see here, for instance, for this council, they're doing pretty well in staff engagement, empowerment and well-being, but actually learning-driven improvement and innovation is probably an area that they want to focus on going forward. And the chart on the right-hand side is showing us the results for that council of all 3 capabilities together against the different characteristics and how that compares when we look at all the councils together. So for this example, there you can see leveraging finance and performance intelligence, 83% of all the indicators for those capabilities are good or strong, compared to 63% of all other councils. So a really, really good level of resilience there for this council. But then when we look at learning-driven improvement and innovation, they have quite low resilience at 20%, and actually other councils are at 39%. So there's a real opportunity there for them to improve and invest in that area. Another thing that we found during this research is that councils generally tend to be really good at absorptive capabilities. That's definitely been a key focus of resilience for councils over the last few years. And we're not just kind of looking at COVID-19. Obviously, a lot of councils have gone through floods and other disruptions as well within the last few years. And they're at kind of 79% of all the indicators for absorptive capabilities are strong and good. That is a very different picture compared to their strategic capabilities, which is a lot lower. And actually, there's a 30% gap in that strength of abilities between absorptive and strategic. And we're actually seeing that profile play out in the responses that we're getting during interviews. So an example of that is the idea that willingness is really trumping well-being at the moment. So amazing, dedicated staff want to do as much as they can, pushing themselves. And despite councils trying to put well-being first, staff are so focused on the adrenaline and getting through that actually they've got this point now that they are fatigued and exhausted and not pulling on their core strength just yet. The other thing that's coming out really clearly is that resilience has been invested in deliberately, and there are plans to continue to invest in it going forward. And as a capability of the core strength, it's that ability to invest and to strengthen, I think, is really important and a real learning that we can take from the recent pandemic. So some examples here of councils deliberately investing in skills to strengthen their resilience have been around building really strong wellbeing cultures. So if you're generally having a culture about staff feeling valued, motivated, engaged, and those councils who have got that strong wellbeing culture were the councils who identified before the first lockdown that working from home wouldn't work for all of their staff and put in alternatives before starting to work from home and not having blanket policies. There's also examples there about having really strong relationships that have created a really strong foundation. And councils have also started to highlight those capabilities that they want to strengthen going forward. A lot of this is around IT infrastructure, but there's also people are talking about having a multi-skilled workforce going forward so that they have that flexibility in their resources, and also that bit about levering information, that suddenly they're realizing that there's a lot more information out there that could be used to really help their operational and strategic decision making going forward. So I'm going to just hand back to John now to hopefully just get some of your inputs on what we've gone through so far.
Thanks, Henry. If you want to stay on camera and also off mute, then we're very happy to kind of take questions, but also to pose a question to the group as we sort of get into this first Q&A section, which is actually, given your experience of working on the ground in complexity, what else does this assessment framework need to be cognizant of? In terms of just framing that again, just as a reminder, we worked with 9 county councils, although at least 3 of them I think are unitary counties, county unitaries. So there is a full range of services that we worked with. We worked with them over October to December with a mix of interviews, in-depth interviews with the senior team, and some data requests and some follow-up investigations into 1 or 2 areas. But I would say at this stage, from a research point of view, it was relatively speaking light touch. We'll come on to in the second section a bit more detail about that. But any questions you've got would be interested to respond to. And Henry, the first one that someone's asked here, James Ronicle has asked, how did we measure these capabilities? Do you want to just describe the process you used?
Yeah, sure. So obviously with the framework and the indicators, we assess the strength of the evidence that was provided through interviews with senior leaders. So we interviewed about 3 to 4 senior leaders in each council. We also had a kind of quantitative data request, and we also did a bit of web research as well of their council website. And in terms of the indicators, we assess the level of evidence, so whether the evidence was strong. So really good examples of those capabilities across the organisation. Good, which was sort of fairly consistent examples of good capabilities across the organisation. Mixed, where there were 1 or 2 good examples, but actually it seemed to be focused in a specific department rather than consistent. And then limited evidence, where there just wasn't sufficient evidence to show a good level of resilience within those for that council. And then after we did all of that, we actually had a couple of moderation sessions as well to ensure that there were consistency in the way that we rated each individual council. And then after those moderation sessions, then we actually undertook the analysis for each individual council, as well as then across all 8 councils.
Thank you, Henry. Are there any other questions at this point, or should we press on? Give it a sec.
There's a couple more in the Q&A.
Thank you. Right. From James Mass, we have, what interventions would you prioritise to help the workforce keep going for the marathon, especially those still trying to do it on sprint mode? Shall I respond to that one, Henry? Thank you, James. I think our interaction with the chief execs and the leaders was really instructive in this area. There is a point at which leaders and managers need to take the decision to pause out of the hands of the staff who are pressing on. And that's a judgment call you all need to make. But our experience of that is that where willingness is trumping well-being, it means that people are not personally taking responsibility or at least aware of the impact they're having on themselves and on the workforce. And I think our concern would be that downstream, this year's coming up is going to be a really challenging one for local government in recovery, in budget delivery, and all the other things that have to be done. And as a result of that, we're going to have leave that's stacked up, that hasn't been taken, that's been rolled forward, possibly exceptionally. And people's well-being and capability will be much diminished. So I would be thinking about time off and enforcing some time off where you possibly can. Other questions? Paul has asked, you interviewed senior management, what about a range of interviews with employees further down the hierarchy? Very different perspectives, perhaps. Absolutely, that potentially would be. I mean, Henry, do you want to come in and pick that one up?
Yeah, so it's a really interesting question. And actually, we are now starting to do that with a couple of councils that we're working with more in depth. So this first round was really about getting initial idea in terms of being able to develop and iterate the framework. Now we feel that we've got that framework, we're starting to actually, sort of explore it more and dig down. But absolutely, I'm sure there are definitely going to be some different perspectives in terms of senior leadership, middle management, frontline staff, which we're now starting to explore.
Just one build on that is with a couple of clients now, we are actually using this model with all the 62 indicators down at a service level. So we're testing whether it can work at a service level rather than just an organisational level. And in another place, we're actually using it at a system level to see about the kind of community of organisations and network beyond the council. So it hopefully has some flexibility because it comes from an academic background of studying complexity. There should be some read across. We're hoping that that's true. Two more questions. One is, do we find that good core strength automatically means better adrenaline, or is it more nuanced than that? That's an interesting question. I think I'll let Henry come in as well, but my instinctive response to that is that, in a sense, yes, but because you have to use less adrenaline to respond to disruption. So if disruption is seen as the normal thing, then you have systems in place, then you won't trigger an adrenaline response in future. So one thing that's interesting about local government is they have this thing called Gold Command. Those of you familiar with local government will know that. And they're now starting to question what events are appropriate for using Gold Command for or not, or Silver Command, or whatever other commands they want to go. So they're trying to calibrate their responses better to the reality of disruption out there. And more of them are starting, I think, to accept that you can't have a locked down business as usual and everything else is different and disruptive. And they do need to think differently about that. And the final question I've got here is, if we assume disruption is constant, when does an adrenaline response become a core strength response? Question, do I know about the answer to that? Good core strength automatically mean better adrenaline. I think one of the things we went into this piece of research with as a theory, a hypothesis, was that between a sort of day and a week, local government's response was generally well honed. Disaster emergency, for flooding or a fires or riots or trams, these things have a time limit. There's a week or so. But beyond that, it felt like that was because we were going to a pandemic which had an undefined end. we ought to be thinking more broadly about core strengths. So I think if we want for a kind of more definition, I think a week is probably roughly right, but we haven't formally quantified that. Henry, did you have any build on that?
I suppose one of my builds is we've been talking a lot about, are they actually done consecutively or concurrently? And I think there is an idea that even when you're in that adrenaline response, you should be still using some of that core strength at the same time. So it's not necessarily that you start with adrenaline and go to core strength. The idea is that you're continuously got that core strength, and every so often you're using the adrenaline at the same time. But yeah, it's definitely something we're learning more about as we're going on this journey. Yeah.
We got a question here. Someone's quoted our own book back at us, which is always a challenge here. So Samantha has asked about what learning tools and methods we're using to help busy public bodies understand complex systems. I mean, a whole range of them, but I guess there's two specific things that I think are really important here. One is specifically with this framework, we are right now crafting our individual council responses for the individual councils who participated, and thinking really hard about how we share that with them. Raw percentages are not very helpful at some level. At another level, they are really helpful. And so we have to really balance that, understanding that we don't want to create a race to a number that is false. We want to create in illumination for the client, understanding, and also that when we're doing a framework of this type, we don't want to create a sense in which we're criticizing them or as an Ofsted type inspection. This should be a learning event that we can help them with. And so we find that helping our clients in this space is a constant repetition of helping them to reframe the way they look at their management challenge. And there is a tension. The second big part of it is there is an inherent tension within complexity thinking, I think, and great debate to be having. Should you measure anything? Can you measure anything? And as soon as you measure something, does it makes people game the system, particularly in public services, and so therefore it's a bad thing. And I think we have to resolve, or we have to work on resolving that. I don't think it's easy either or. I think if you start from the right place of saying, no, we're in a complex system, our job is to learn, then the information that you're gathering in, even if it's presented numerically, is for learning purposes and not for punitive purposes. And I think that's an important feature of it. Hopefully that's answered some of the question. Okay, shall we move forward to the next section? Thank you all for your questions and very interesting stuff. So next section is just all about unpacking this a little bit further, and then giving you some of the kind of strengths and weaknesses of the framework itself. So firstly, here is a summary of overall the three levels, so absorbative, adaptive, and strategic, and then the characteristics down the left-hand side. We've quantified the number here of through our judgment that were demonstrated strong and good capabilities within local government, and when we've added them up and aggregated it across the whole of the cohort who participated. Well, what you can see in here is that there is a really mixed picture across the sector, and one of the things that's really striking to us is how, relatively speaking, strong things like decision making, engagement of staff are in the absorptive space, and then how, relatively speaking, weak the learning processes are within local government compared to some of the other characteristics. It's not that they're non-existent, but they are, relatively speaking, weak across all levels. And then in the strategic space, how much, relatively speaking, weaker that is, particularly around space like resource flexibility and relationships, in contrast to some of the other measures. So this was a profile, I guess, if you'd asked us beforehand, to guess, we might have said that local government would be strongest at keeping going. And I have to say, without wanting to come over as too critical, we've been incredibly impressed with our clients and the rest of local government in their ability to keep going during this crisis. I think it's a space that's not often talked about compared to health. Obviously, they're very much in the front line of this. But our experience of working with local government has been very impressive. They are very, very good at keeping going. It's kind of what they do. But it does mean that potentially those other spaces are underinvested in. And we put a question there, which maybe we can kind of capture as we go through, which is, would that profile perhaps change with other public sector organisations who we haven't applied this to yet? Henry, do you want to move us forward? And then the other key feature we wanted to just highlight was how, although we have just done some aggregation and said, broadly speaking, there is weakness in learning and there is strength in absorptive compared to strategic. Overall, there was some really different profiles within the councils that we worked with. So each council has a very unique profile with their own strengths and their own weaknesses revealed. And if you just look at one number in this table, which is the bottom row, the range in performance between the lowest and the highest performer in each area is quite significant. So 37% for absorptive, 53% for adaptive, and 33% for strategic. You know, this is a unique kind of profile. Although local government has greater strength in absorptive overall, each individual authority is this is the result of years of management choices and systems that they have in place and investments that they've made either consciously or non-consciously over a period of time. None of the things that we have been measuring are statutory services that are mandated by law or specifically funded by law. They're all characteristics of an organisation that are revealed when you look at them from the outside. And so it's interesting how different each council is. And I think, in a sense, one of the takeaways should be this is a unique individual position rather than an aggregated sector-wide set of trends. One feature of the framework that I suspect will improve over time, but wanted to reveal it now, is how in many cases we weren't able to discern enough data to make a call either way. And what we've shown you in terms of the numbers is the data where we were able to make a judgment call. But this is the data when you add in the information or the scoring we weren't able to quantify. So if you then said, okay, to give you an example, during the interviews or the data gathering, a council wasn't able to demonstrate data in this space around, for example, the worst one on this one is in 3/4 of the questions that resource flexibility was a really difficult one for people to answer in the strategic space. Available data was very poor. If you use that as a criticism, i.e. if you make a judgment call about whether that's a good or a bad thing, the absence of data, and then you add that in, it reduces the scores across the board, as you would expect. And so just as for example, we've put those numbers up. So if you counted not having data as a bad thing, then obviously it reduces the performance that we were able to discern in local government across the board there. And the right-hand side of that slide shows those data. One of the things we didn't feel it was fair to do that, particularly given the fact that we haven't done a kind of major in-depth, lengthy month-long, 6-month-long study. So this wouldn't pass a kind of a really high bar in terms of evaluation at this stage. So we felt it better and fairer to avoid making a judgment call about that at this stage. But we thought we ought to share that part of the way we've done the work. So kind of what's next for us, and this is kind of wrapping up. We're taking this very seriously as a piece of work that we're doing with our clients. So as I said earlier, we're starting to apply the framework to test it in real life with, if you like, kind of live clients who are interested in resilience as a general thing they want to build towards. For us, we'd like to apply this to a wider range of councils and to other public sector bodies to see if we can test the robustness of the framework with a wider group. Also with networks like this is partly why we're here, is to try and share some of the framework and get collaboration going in some way. So, you know, can we build this out? Can we read this across into other sectors? Are there learnings that we can bring from other sectors too into this? So we're very much here as a kind of, we're sharing where we've got to. This is our research project that we're almost finished the first phase of. We're now moving into live use with paying clients, but we're here as a kind of a part of our involvement in this wider network to share the insights and hopefully to get some contribution and potential for collaboration. So we're going to pause there. We will share the slides separately, of course, but very, very interested in getting your feedback and thoughts. I think they've been put off by our pictures, Henry.
We have some questions coming in on the chat, and there are some in the Q&A box.
Thank you. Samantha, we've been looking at diagnostics for VCSEs. Can broker a conversation with the lead on this at the moment? Well, the answer is yes, please. Thank you. That's really interesting. Obviously, you know, voluntary organisations are a huge part of the network of systems that local government is a part of, and their ability to kind of contribute at short notice is really vital. So thank you. Yes, please, Samantha, we'd be interested.
I think, can I add to that, John? Actually, I think there's two areas there. First is actually, as you say, because BCS has been part of the System Connect councils. From the council perspective, what we're getting is how they've really gone into an equal partnership with the VCS, especially during the COVID pandemic, and how they want to enhance and optimize on that going forward. So we've kind of got that side of things, and to see that from the VCS perspective, but also actually that be really interesting to see whether we can apply the framework to a VCS organisation rather than just a council organisation, and how we might need to adapt the indicators for it to work within the VCS. So kind of two different ways. I think that would be really interesting to explore.
Yeah, thank you. Couple of questions in Q&A, but one from David on redundancy as a key factor in resilience, looking at bed numbers in hospitals and beds and staff, which is a similar project to problem to adult social care. So yes, absolutely. One of the things that we've been seeing during this crisis is that actually it's the staff that's the real problem in terms of the capacity, and not necessarily the beds, both from an illness but also from an exhaustion point of view. So direct impact of COVID, but then also, if you like, subsequent impact of COVID. And actually on the staff side of things, one of the interesting questions for us is resource flexibility at a organizational level. So one of the really examples that really stuck with me during the research was one of our clients saying, that they've been really proud that at the beginning of the pandemic, they managed to get 250 people to volunteer to do new roles at the drop of a hat. So they all said, I'm up for taking on a new responsibility as we go through this COVID lockdown response. But because of a lack of processes and a lack of HR flexibility, they were only able to redeploy 50 of those people at pace. And they'd regretted that hugely because not only did they lose the enthusiasm of the staff, but they also lost the opportunity to get frontline workers into important roles. And actually, the ability to kind of redeploy staff, I think, is a fundamental question for local government, because of there are so many kind of professions that some of the ability to move staff into different services has been lost, I think. So I think that's an important feature. And you saw in Henry's presentation, the research, one of the weaker areas in the strategic space. Questions in Q&A. Presumably this framework could be applied to one part of a council's work, e.g. delivery of one particular service and how resilient it is to change. Correct, yes, exactly. And in fact, we're doing with one of our clients right now, we're doing that. We're deploying this framework to adult social care as a service to try and look at their resilience within the overall organisation. So yes, and that's something we are actively working on. Paul has asked, could we have some clarity on the definitions, e.g. strong leadership? Henry, do you want to just give us a quick overview of that?
Yes. Sorry, did you say the question was in the Q&As or in the comments?
In the Q&A, Paul has asked a question of what he wants clarity on the definition of strong leadership.
Okay, so in terms of strong leadership and decision making, we were looking at that from obviously an absorptive point of view, adaptability point of view, and a strategic point of view. And in terms of the absorbative, what we're looking at is kind of the ability to quickly execute kind of continuity plans and be able to respond to disruptions, about being able to flex governance processes, about being able to accept that some activities, normal BAU activities, will be put on hold and some services not delivered in order to be able to respond to the disruption. When we look at adaptive capabilities, we're looking more about the ability to balance short and long-term priorities in terms of responding to a disruption, to be able to make decisions about when to restart that business as usual activity and to stop disruptions that are stop disruption specific activity. And also that ability to maintain support and constructive challenge at a senior leadership level. In terms of the strategic capabilities for strong leadership and decision making, we're looking there at kind of shared ownership of the kind of contingency, business continuity planning procedures, organisational wide and shared ownership of strategic priorities to have that kind of unity of purpose. We were also looking at governance processes and decision making just generally being time effective, so high quality decisions can be made quickly and at the right level with empowered decision making, that commitment to act on those decisions as well and the ownership of its impact. We're also looking at the ability to anticipate and predict surprises and minimise negative consequences. Because we're focusing very much on councils, we've got that trust and respect between officers and members, recognising that obviously for other organisations, it might be trust and respect between different types of people. And then also about leaders building truly collaborative leadership cultures and a sense of teamwork across the organisation and working together and breaking silos. So kind of a range of different things against those three capabilities.
Thank you, Henry. Just building on that, and Samantha's asked this question. Thank you for the detail on your contact details, Samantha. That's really helpful. Are we making our Diagnostic for Public Bodies and Open Access tool? The honest answer is we haven't decided yet. It does partly rely on how much interest there is in the sector and beyond. When we spoke to leaders and chief execs at the CCN, one of the questions they asked us was, would we make this available to the MHCLG to give them an understanding? So all of that we're well up for, and would happily kind of get into a conversation with whoever needs to about that. But if you're interested specifically in the detailed framework, then anyone who's been on this webinar has our contact details. Please get in touch and we'd be happy to share. We're not particularly precious at this stage about it. We're interested in collaborative approach. Francois asked, what makes this research project complexity inspired research? So firstly, we as a business have absolutely come from that paradigm. So we assume that all the work that we're doing is located in complexity, and therefore all of our tools, etc., that we advise our clients about come from that perspective. More specifically for this piece of work on resilience, it was inspired by some of the academic papers that I read where, and this is partly why we had to adapt it kind of iteratively, as Henry described during the presentation, actually came from some academic research around complexity in resilience in systems in different fields. So we were looking at the kind of starting point for our kind of structure and flow of the framework was very much came from academic background rooted in complexity research. I hope that passes whatever test we needed to pass for that to be credible. A couple of other interesting bits of feedback. One is about using the potential for using percentages for comparative purposes. Could we use broad bandings and avoiding specific percentages that might be more useful? That's from Paul again, and also about where to draw the organizational boundary. Actually spot on that. Very important to, and we wrestled with the issue of organization or not organization. I think one of the things in complexity is having any kind of organizing body is somehow kind of comes up against the challenge around complexity in complex systems. But the fact is they exist, they have budgets, they have chief execs, they have processes. And so, we see our job as helping them to better understand complexity, and drawing the boundary is absolutely a core part of how we see our role to help them, not the organizational boundary, but the system boundary, even when the organization's at the center of it. But absolutely, yes, there will be conflicts within there. Other comments. Have we got a published paper on which this could be used as a reference? Henry's working really hard on that at the moment. So we should have one available in the next, I would say, month or two. So pretty soon. Other questions. I'm interested in the individual council unique profile against your framework. With a central government hat on, I'm interested in aggregation upwards for an overview of local government capacity. This might require sector-wide evaluation against the framework. Yes, what conclusions could be drawn from sample-based scenarios? Great question. So it's specifically designed to be able to aggregate. So that's, it's inbuilt in the framework that you should be able to do that. But the issue will be getting an honest appraisal of the strength of individual councils. So when a council is participating in the way that they have with us, it is voluntary. They're interested specifically in our advice to them. And they are deliberately not choosing to be part of a national framework against which they can be named and shamed, to be brutal. So I'm really interested in how that could work. We're very up for helping central government and MHCLG get a picture of resilience. And we're open to hearing from MHCLG on that basis, and through our partnership with CCN, that may well come about. There is another question in here which is related to that, which is it just a case of giving councils more money, or even with unlimited pounds as their scope for further action? I think it's unarguable that the sector has been has had less money than many other sectors in public services compared to being a part of public service. Local government has had less over the last 10 years. I've got to say though, we are deliberately not talking about money here. And we're not trying to say that the sector needs less money or more money. What we are saying is that it's not the driving force around resilience. Some of the councils that we engaged with had big reserves, others had very, very small reserves, but their resilience will be dictated more about their ability to do something with that money as opposed to having more money. So how can I put it? You need enough money to have some flexibility. So you have to have some buffer zone, all right? But the resilience seems to us to be a much more profoundly nuanced thing than just having money or not having enough money. And we're attempting to define that is what we're trying to do here. Henry, do you want to?
Yes, I did actually try and answer that question, that if you have high levels of financial reserves, are you likely to be more resilient? And we've only got 8 councils, so it's really hard to come to any conclusions. And there is a connection between resilience levels and the amount of reserves. But I thought what was really interesting is that the councils that were most resilient, it was their leadership and their relationships in terms of capabilities that were really strong, not necessarily their ability to leverage financial information. I mean, it could be that because they had high levels of reserves, they were kind of more able to then spend time exploring relationships, enhancing them, and focusing on their leadership. But it's definitely not as simple as more financial reserves means that you can be more resilient. And with more and more councils that we're applying this framework to, we'll be able to continue to kind of revisit that, to be able to explore that further and see what are the other variables that influence that.
Thank you, Henry. Just, I guess there aren't any more questions that I can see, but two things I did want to mention. One of them is Francois asked about whether this could be applied to the US school district. Get in touch and we'll talk, maybe share the framework with you, be interested in your feedback. So thank you for that suggestion. And then finally, the point about, which I don't think we quite answered, which was around what conclusions can be drawn from a sample-based scenario. I think cautious ones is my main answer. We're very clear in our minds that if you're applying a kind of proper scientific evaluation model here, we haven't got enough participants, and we probably haven't gone to enough depth in the research to really study this. But what we have done is, in engaging with our clients, is actually had a nice iterative build to the framework. So we're now fairly comfortable that this is robust enough for practical use day to day. And our intent here, in a sense, isn't to provide a framework for national government so much as to provide a practical tool for our clients and for the sector generally, and hopefully for public services beyond local government, to give them a sense of what good looks like. Because I think one of the problems we've experienced so often in local government is, and in other public services, is what good looks like is defined by statute or by regulation and not by the kind of managers in the system. And so this, for us, we're trying to provide a tool here that's just got practical value. So we'd be cautious about drawing sample-based scenario conclusions, not hard and fast ones, but we think there's some interesting stuff here, and we will be publishing some work over the coming months related to this, so watch this space. And please do, anyone who's got anything they want to follow up with, please do get in touch. I'm particularly interested in Dave giving us more information about the 14th Army and how they demonstrated their resilience. Unless there are any other questions. Dave, do I hand over to you to conclude?
Yes, I will do so. I thought that was a very interesting and useful presentation.
Thank
And just on the point of the sample, it's a set of cases, right? Yeah. And each of the cases in a particular set of circumstances, they are similar cases, but I think it's very, very important to recognize that this kind of case-based work is actually a very important way in which going forward, right? As for the 14th Army, it was because one of my scoutmasters who served in it said that he was actually a signal sergeant who ended up commanding an infantry platoon with a Tommy gun, right? And he got mentioned in dispatches for it. Yeah, so I thought it's an example of people rapidly reacting to a particular situation. And if you read the history of the 14th Army, you find that was a pretty grim history, but the guys in the admin box did extremely well. Right? So thanks again. That's been really useful and interesting. For me, it has, and I hope it's been the same for the rest of the participants. So cheers for now.
Thank you very much. It's been a pleasure to be here. Really appreciate it.
Thank you very much.